Beyond Housing's once and for all effort to strengthen families and transform the many under-resourced communities in North St. Louis County covers many different areas, from housing to education, economic development, and so much more. Today, we're focusing on the role that health plays in creating successful and thriving families. Poor health is both an outcome and a driver of poverty. Many people in under-resourced communities do not have adequate access to health care, which leads to unmet health needs that can make it difficult for parents to work and for children to succeed in school. We recently spoke with Beyond Housing CEO Chris Krameyer and Adacia Session, a community health worker with Beyond Housing, to see how they're removing health disparities to create a stronger, more prosperous St. Louis once and for all.
First and foremost, it's what the community has told us, right? We use our Ask, Align, Act methodology. We've talked to folks in the community about what's important, what are the challenges, and what are the things we can do together to make your life as good as it can be. And health came up over and over and over again, knowing that, again, the second piece, all the data says chronic diseases in our community are much higher than the rest of the region. So we knew we had to focus on health, focus on how we improve people's health, access to health care, all the different things so folks can live their most healthiest lives.
Inside the 24-1 communities, the main two chronic health conditions that we've seen are type 2 diabetes in adults and childhood asthma in children. When we started the partnership with Christian Northeast Hospital, they said that when their emergency room admits, they had those two chronic conditions as the highest. So we decided to start with those and work with residents there.
Residents who have little to no access to health care or health care benefits.
When participants have come into our programs, whether they are a child with asthma or whether they are an adult with type 2 diabetes, we have been able to link and connect our participants to primary care providers through another one of our partners, Athenia. We've also been able to reach out to other primary care providers and get them linked and connected. I have seen working with participants just transformational change with behavior change, and participants, maybe they came in the program with an A1C of 8 and they decreased that down to 4 or 5. So these are the kinds of transformational change, and it's not something that takes place overnight. It is a working through and working with the participant to help them feel more comfortable and that they have that self-efficacy that, yeah, I can do this and I can manage this condition on my own. So I think those are some of the successes that we've seen in our program.
A transformation from the inside out that many people take for granted. A support system that goes beyond housing to make a holistic metamorphosis for residents in North St. Louis County.
Well, I think number one, the main thing is that support to reach out. Sometimes we put other people and their needs before ourselves. So you see moms putting their child's needs before their needs, and you see older adults taking care of parents and taking care of other family members and relatives and helping them with their needs, but they're not necessarily taking that initial step to make that telephone call. And so, or to reach out or use that contact that they were given when they went to the emergency room. So once I get a referral either through Christian or I talk to a community member in the community, first thing I want to talk about, what resources have you already been provided, and have you accessed those yet? And if not, can we work that together? And that becomes what their goal is, or that becomes the focus.
Creating an ease of access to health care so people can reach optimal levels of health and wellness.
If you don't feel well, if you struggle, you're going to not be able to go to work as frequently. You have to call off work, you have to miss work. We see a lot of asthma in kids in community. Kids miss a lot of school because of asthma. Again, these chronic diseases impact literally your day-to-day living. If you get the right care and have the right support, your life can get better, you can get healthier, and again, these chronic diseases can get better, and they won't impact your life in such a significant way.
Turning the tide to give people a healthier outlook on life.
Well, I would say that the work that we have been doing here is transformational, and that's really the focus. We want to keep our work transformational. We want to everyone to have the support that they need. And if they don't have the support that they need, we want to help them navigate. The healthcare network is a broad network, and so sometimes when you're sick or sometimes when you've been given that diagnosis, you don't know which direction to go in. And so we want to just provide that support and just say that we're here to help.
Help that promotes health. In North St. Louis County, Chelsea Haynes, Studio STL. To learn more about Beyond Housing's work to create a stronger, more prosperous St. Louis once and for all, you can visit beyondhousing.org or dearlou.org. Don't go anywhere. We'll have a lot more Studio STL in just a couple of minutes.